from the standpoint of hemorrhoidal banding, that is something we can do in the office for management of hemorrhoids. I think people get frustrated sometimes because they try all of the over-the-counter preparations like Preparation H or Tux pads. They try fiber, try these various things to try and calm hemorrhoids down, but nothing really works. So with the banding, it is an opportunity to intervene and do some therapy for the hemorrhoids to where they don't, hopefully won't bother you anymore. To have it done is really, it's a process where it's a quick rectal exam, and once we determine that internal hemorrhoids are there, the bander just goes inside the rectum up to truly about a centimeter or so. And once we're in a position where the hemorrhoidal tissue is met, we actually are able to pull back on, there's this plunger and it pulls the hemorrhoidal tissue into the tip of the banding device, and then we're able to roll the rubber band onto the hemorrhoid. And basically it's just cutting off the blood supply to the hemorrhoid. So that tissue will eventually fall off, and it leaves behind a scarred, basically tacked down area. So hopefully you won't have that swelling, burning, achy sensation after that. It's excellent for those symptoms of burning, aching, itching, but it's also excellent for any kind of bleeding that may be occurring. So typically we do one at a time. Like I say, it shouldn't hurt. There's nothing that you feel you're having cut or taken out. If anything, you might feel a little pressure, and usually that lasts for about 24 hours. And after that, you're back to feeling normal. Generally, we'll let that site heal up for about 2 weeks and then have you come back. And then if there's any remaining tissue, we can tackle that as well. So hopefully, after 2 to 3 sessions, the entire area around the anal canal is taken care of, and you're feeling a lot better. Don't worry about feeling embarrassed. That would be the one thing. I think that's really what keeps people out of the office, is just they are embarrassed and they just won't come in because they're not really sure what to expect, or they're embarrassed to talk about it. This is really easy, and again, it's a process that I'll talk you through the entire session. Again, if it's something you want to think about, read a little bit more after coming in, you certainly can. But if you wanted to move ahead, it's really very straightforward. I think people get nervous thinking this may be a process similar to colonoscopy, and it's nothing like that. The process itself typically takes no more than about a minute or two. So it's very, very easy to do, and there's really no reason to be frightened about it.